After 7 months in quarantine, people around the globe are pleading for a coronavirus vaccine. We're discussing what will happen when it's finally ready. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat and additional supporting sponsors.
2020 has brought its fair share of battles. 1 million people globally have died. Schools have shut down. Millions have been laid off. COVID-19 has people gripping their seats wondering when the chaos will finally end. Many researchers say we won't be able to move past lockdown until there is a coronavirus vaccine. Local officials are already in the planning phases, so they are ready to go as soon as a vaccine becomes available. The timeline for a vaccine is projected to take anywhere from a few months to over a year. On this Nevada Week, we're discussing Nevada's vaccination plan. Joining us are Heidi Parker, Executive Director of Immunize Nevada, Dr. Court Loff, Acting Chief Medical Officer for Southern Nevada's Health District, and Brian Labus, Assistant Professor at the UNLV School of Public Health and member of Governor Steve Sisolak's COVID-19 Task Force. Well, thank you so much for joining us. We really appreciate it. I cannot believe that we're at flu season already. I think we've all been so entrenched in COVID-19, and I know that's probably going to be a main part of the discussion here, and we're talking about flu. So many new variables at play here. I want to start off and just go around our virtual table and really get your perspectives on what are our projections here. Do you think we're going to see a good flu season or a bad flu season? And Brian, kind of our resident public health expert we've had on the show so many times, welcome back, and let's get your perspective first.
Well, I don't think there's any way to predict what kind of flu season it's going to be. We try to do that every year, and it's just not something we can do based on even decades of knowledge of this disease. I think the interesting thing for this year will be that all the things that we're doing to stop COVID-19 will also help stop flu transmission. So we have the potential to see a more mild flu season, and that's exactly what they saw in the Southern Hemisphere this year, where flu season was almost non-existent. So we would hope for the same thing, but there's really no way to predict that.
Heidi, what's your perspective? Do you think we have any more specific predictions? Brian's saying it's really hard to predict, but maybe we've got, as he mentioned, Southern Hemisphere had a much lower rate. Do you think we're going to have something similar here?
You know, I think that the most predictable thing about flu season is that it is unpredictable. And I think that's why we're always emphasizing the prevention piece, because if we don't know what's coming, being prepared is the best way to handle that.
And Dr. Loff, what's your perspective here?
Yeah, I really don't have anything to add to what the two other panelists said. It's very unpredictable, but I think we're all very hopeful that perhaps the measures that we're taking to prevent COVID transmission will help prevent the transmission of influenza, and therefore we'll have a much milder influenza season as well.
As you all mentioned, prevention is such a big piece of this. Let's talk a little bit more about that, and maybe we start with the vaccination piece of this. Heidi, I want to come back to you. You give us maybe some historical perspective on where we are on our vaccination rates for influenza in the past, and can maybe that be somewhat of a predictor moving forward on where we might be on just the prevention side of this?
Unfortunately, Nevada continues to be last in the U.S. for our vaccination rates. The CDC just released our 2019-20 data, and while we saw some decent gains, we're still last. So that's the unfortunate piece of rankings, is that even when you make improvements, others are making improvements too. I think for us, making sure that we're not last this flu season is of utmost priority, just making sure that those at-risk populations are out there getting vaccinated. And we just don't want to see that convergence of flu and COVID.
Yeah, and let's talk more about maybe the most at-risk populations, and let's bring COVID-19 into the discussion here too. Of course, we've seen some disproportionality in COVID cases in some of our racial and ethnic minority populations. Vaccine rates, are we seeing kind of a lower level of rate in some of our persons of color communities?
We do. And again, looking at the new data, while we saw gains in those populations, those communities, it's still not where we want them to be. And it's really driving some of our outreach for this flu season to ensure that we're reaching those populations.
Brian, let's talk about this vaccine piece a little bit more here. Of course, we're in COVID-19. We're dealing with a lot of closures. People are very sensitive to being in close contact, and we're talking about vaccinations here where you need to have somebody in close contact to you, not to mention waiting rooms and paperwork and everything else that goes along with the vaccine. Are you concerned at all that we're going to see a much lower vaccination rate because of where we are with COVID?
That's obviously a concern. We've seen lower rates of people going into doctors for their normal visits and visiting the dentist and all those kind of routine things that people do. And the places where they normally get their flu shots, the pharmacy, the doctor's offices, they're avoiding them more than they have in the past. So we want people to understand that there might be a little bit of risk involved in going out anytime, but the benefit of this can be huge. It can keep you from getting a disease that can kill you or getting this disease on top of COVID. So there's obviously a concern just about the way we access healthcare during a pandemic like this, and it will probably lead to some lower flu vaccination numbers this year if we don't do something about it.
On the flip side, Dr. Laffa, the social distancing, the use of masks, of course, a lot of more COVID precautions, washing hands, things that typically we would assume might also limit the spread of flu are there. But there's probably, as we already mentioned with the vaccination piece of this, there's negatives to where we are with COVID-19 also. How do you think COVID-19 then is going to affect our influenza rates? What kind of impact do you think it's going to have on it?
Well, again, it's hard to really speculate what's going to happen with the influenza season or what's going to continue to happen with the COVID pandemic. But again, I think it goes back to some very basic measures. Make sure that you get vaccinated against influenza and make sure that you can continue to follow those precautions that we're all trying to follow for COVID, social distancing, wear masks, things like that.
Brian, I want to come back to you and let's talk about maybe the flip side here, the positive or negative impact flu could have on COVID. The CDC has come out with a statement. I'll read it really quickly. For the upcoming influenza season, influenza vaccination will be paramount to reduce the impact of respiratory illness in the population and resulting burdens on the healthcare system during the COVID-19 pandemic. Is the concern here that if we do not get a good handle on the flu season in general, that we could see kind of a overcapacity on our hospital system here?
That's a major driving force behind the things we're doing with flu for this year. It's not just having our flu season, which puts a significant strain on the entire healthcare infrastructure. It's having that on top of COVID. If we're already at capacity for COVID, flu will easily push us over that. And the combination of those two things can grind basically our emergency rooms and our hospitals to a halt.
Let's talk about maybe some other challenges here. Another one I want to bring up is public trust, especially with vaccinations. And Heidi, I want to go to you on this. We've already talked about how we have a much lower vaccination rate maybe than other states have. Have you been able to gauge kind of where public trust factors into this?
I think for our routine vaccinations, public trust is still very high, and we want to ensure that continues, as we're approaching a COVID vaccine. I think when I look at some of our immunization rates here in Nevada, there's a lot of concern about access issues, those disparities that we're seeing in the rates, where our Medicaid population, our uninsured families. And I think that's really where we're putting our efforts, is to ensure that they have every opportunity to get that flu vaccine, whether it's in their neighborhood, at a free clinic, knowing what those options are and giving them the opportunity and the resources to then access them.
And in just a sec, we'll transition to talk about maybe some of the solutions to improve that access. I wanted to bring up maybe another potential challenge here too. This is something we talk about no matter what sector, what topic we're covering here on Nevada Week, is just funding. The federal government does provide early preparedness funding, $1.3 million I have here. It doesn't sound like a lot of money for early preparedness. How are we doing? Dr. Loft, let's talk about just Southern Nevada Health District here. Do we have ample funding to be able to execute a vaccination program and the outreach we need for our preparedness here?
Yeah, I think we do. And the reason for that is we have a tremendous infrastructure in place currently to provide routine vaccinations. And, and that includes like our health department clinic, the staff that we have, the resources we have to do the outreach, to actually provide the vaccination. So I think it's certainly an additional add-on for us to go out to the community to provide flu vaccine, as well as to provide the flu vaccine here at at the health district. But again, we're really building upon a capacity that we've had in place for a number of years. So there's really no reason why we are going to be challenged with being able to provide the flu vaccine this year.
And Brian, let's get your perspective on this too. Just Dr. Loft's mentioning our infrastructure here is pretty solid. You feel the same? And are we okay as far as how much funding we have to address an issue like influenza?
I don't think you'll ever find a public health person who says that we are overfunded when it comes to anything that we want to do. Nevada, public health isn't funded very well, and Nevada usually ranks at the bottom of that. So we have system-wide issues with public health in general. But if you think about the flu vaccinations, it's not that you're just going to the health department to get them. Any pharmacy in the county is going to have them. You see them advertised everywhere. So it's not like there aren't places in your neighborhood. There are plenty of places that can provide this vaccine beyond just a couple of doctors or the health department. So we do have some of that solid infrastructure, but even then, it doesn't mean people always can get to it. If you have a pharmacy across from your house and they're open from 9 to 5, and that's when you work and you have to work to pay your rent and do all those things, you just can't get there. Not everybody has that same access. Even if it's physically nearby, there are all sorts of challenges in basically getting shots into people's arms.
So maybe let's transfer now, Heidi, and let's talk about the community-based sector here and talk about, for one thing, the amount of funding you have and if that is ample and what infrastructure we have to be able to disseminate a vaccine like influenza. And then let's talk about maybe what we talked about before here, how we expand the access that seems to be one of the big barriers.
So the supplemental flu funding that did come to Nevada this season, Immunize Nevada was lucky enough to get some of that funding through the immunization program. We have utilized it to hire a team of community health workers. So community health workers are a longstanding public health workforce, piece. We have already seen their impact on our communities. We have them in both Las Vegas. We have a rural CHW, and then we have one in Northern Nevada as well. And they are on the ground. They are meeting with partners. They are finding out what those challenges are, and then they're connecting all the resources to then solve them. So we already have a number of flu clinics, on our community calendar, probably multiple clinics each week headed into October. And so I think that has been a huge benefit for that funding that did come in to the state. And I think outside of that, looking at how we're increasing some of that access, we're working with a program at the Southern Nevada Health District, the REACH grant, and that's specifically targeting our Black and Hispanic communities. And we're actually partnering those CHW positions up with that program to ensure small clinic access, making clinics, as Brian, commented, so that people feel safe, coming in to that space, whether it's a neighborhood location, maybe it's their barber shop, it's their church, so a trusted location, a trusted champion to then help them understand how important it is to get vaccinated. So we have those partnerships in place. And I'm excited about that because I think there's a lot of on-the-ground work this flu season that we haven't necessarily had the resources for in the past.
Do you think because of where we are with COVID-19, and again, a lot of the partnerships you're talking about, of course, are partnerships maybe that we've had to forge for COVID-19, has that kind of strengthened maybe our infrastructure related to some of these partnerships you speak of, Heidi?
I think for us, we're really looking at this flu season in particular as an opportunity to build all of that ahead of the arrival of COVID-19 vaccine. And so we're really getting that in place, all the pieces we need, all of those stakeholders, so that when that vaccine arrives and we are ready to distribute it to those critical tiers and priority groups, that we have that in place. Absolutely.
Let's Dr. Luff, I wanted to come to you and maybe give some more perspective on this REACH grant that Heidi was talking about, and also maybe some of our hard-to-reach populations she mentioned, African Americans being one of them. Maybe go a layer deeper here on some of the challenges that you are finding in getting access to those populations.
Well, certainly access is a big issue for certain communities, the ones that you just mentioned. And we at the Health District recognize that, and we are working very diligently within our own programs and with our external partners to really try best to identify where those populations are, what kinds of barriers are that they have to access healthcare services, as well as to try to bring them into the healthcare system to provide that healthcare. And we're fortunate here at the Health District now that we have a federally qualified health center, which one of the goals here is really to expand access, especially to those folks who are underinsured, who have no insurance, as well as racial and ethnic minority groups. So our goal with that is really to try to press hard further to try to get these folks into the healthcare system.
I wanted to talk about drive-through and drive-by services, of course, have been so important to the COVID-19 piece, the testing piece particularly. Are those realistic for vaccinations here? Could we potentially see some form of similar setup that we do with some of our testing that we've had with drive-by, drive-through, vaccinations, people in hazmat suits, that type of thing, Dr. Loff?
Yeah, I mean, I think the challenge that's upon us now with the influenza season is to try to develop some strategies that might be useful as we roll out the COVID-19 vaccine. So we're thinking about a variety of different strategies to make sure that we can get vaccine into the arms of people in the community by whatever means is necessary. And that could be large community clinics, it could be drive-through clinics, it could be walk-up clinics. So we're really being tasked now to really put those plans together and to test those plans during our influenza vaccine season. So once COVID vaccine is available, we can actually be able to implement those plans.
It makes a lot of sense, and it's almost like a trial run, so to speak, to try
Exactly.
new measures. Yeah, really, really great.
Right.
Let's switch to the conversation to recommendations here. Of course, we've already talked about so much depends on containment and prevention here. I want to go around our virtual table again and get your key recommendations for us, what we need to know as we approach flu season. And Brian, let's start with you.
It's the same recommendations we make every single year, and I'll probably steal the thunder from everyone else, but get a flu shot, wash your hands, stay home when you're sick. Those are the basic things we tell people to do every single year, and they're just important this year as every other season.
Heidi, maybe he did steal all of our thunder here. Maybe you can give some more detail, but I want to ask about the vaccine itself here. Timing-wise, is it beneficial if we're out getting our flu vaccines right now, as opposed to maybe a month down the road because of COVID or any other flu season that we've had?
Well, the CDC recommends September, October, so our campaign is actually a Nevada Day campaign, so just get vaccinated by Nevada Day. We always encourage people to lead by example. So post that photo of yourself getting vaccinated, take that flu shot selfie. When we see our trusted network, doing this, it makes a difference for people around you.
And maybe who? Can you give us some recommendations on who should get vaccinated?
It's 6 months and older. So obviously there's a lot of populations within that are at much higher risk. And so we want to make sure that they understand that our seniors, our younger children, our pregnant women. But again, it is a universal recommendation, and ahead of COVID, the sooner the better.
And Dr. Loff, I want to get your perspective too. I want to make sure Brian's not stealing all of our thunder. Is there anything else, any other detail you want to give us on what we really need to know?
Well, I think one additional thing about influenza that's not that we currently don't have in place for COVID, and that is that we have antiviral medications available for people who come down with influenza, and we can give antiviral medications to folks with influenza disease as a way to prevent the severity of their illness, as well as lessen the number of days that they actually have illness. So that certainly is an added benefit for influenza that, again, we don't have with COVID currently. So the key there is that if you have a severe if you're having some severe symptoms related to influenza, certainly call your doctor. Discuss the possibility of getting antiviral medication, again, to try to lessen the severity of those symptoms as well as decrease the number of days that you're actually sick. And of course, if you're really sick, go to the emergency department and be evaluated.
Let's talk a little bit more about those evaluations. Of course, in the COVID world, testing is the way to confirm if you do have COVID. Is there a similar test you can take for general influenza as well?
Yeah, so there are a variety of tests that can be done for influenza. There's some rapid tests available to determine if you have influenza, and having that test is key in order to be able to prescribe antiviral medications. The challenge we have with influenza is that it's a viral respiratory illness that looks like a lot of different things. And you want to know that you have influenza before you start treating someone with these antiviral medications. And another key point here is that we really discourage people from getting antibiotics if they have influenza or other viral respiratory illnesses, because antibiotics do not work against viruses, and they can only lead to long-term problems with antibiotic resistance.
Brian, let's talk a little bit more about the symptoms here. Similar to what Dr. Loff was talking about, we've got COVID symptoms, we have flu symptoms. A lot of those are the same, maybe sometimes identical. How do you kind of decipher between COVID-19 and influenza? And at what stage, when you have any of those symptoms, should you be going and getting a COVID-19 test?
Well, at this point, we haven't had to deal with it, luckily. COVID showed up after flu season, really. We didn't have an overlap of the two, so it wasn't a challenge to try and differentiate it. And that is going to be a challenge this fall. They both can cause a fever. They can both cause a cough. There isn't really a simple way to say one is COVID or one is flu. And so I think when you're seeking medical care, it'll be a COVID test and a flu test to try and figure out what's going on depending on your symptoms this year. So that's going to provide some challenge of trying to distinguish two illnesses that overlap quite a bit. There isn't a simple way to do that just based on one particular symptom. The one symptom we've heard of with COVID that we don't really hear about with flu is the loss of taste and smell. But of course, when you're congested, when you're not feeling well, you have a little bit of loss of taste and smell anyway. So again, that's going to be a little difficult to figure out which disease you're actually dealing with.
And Brian, how about just transmission factors? Of course, we've heard so much about COVID being expelled through the air, contracted through the air. Is there a reprioritization we're dealing with flu here, where maybe a touch is maybe more important than communicable through the air, or is it the same?
It's basically the same. You're talking about close contact with other individuals. The main thing is coughing and sneezing on each other. Those surfaces that you touch commonly are less of a factor. Doesn't mean they're not a factor at all. They're just not as important as that time you spend in close contact with others. So basically everything that we're recommending to stop the transmission of COVID will also stop the transmission of flu. We can recommend these things every single year, but nobody listens. But now that we have COVID, people are paying attention. So it will make an impact on flu transmission.
Heidi, I want to come back to the vaccination piece of this. There is some skepticism that the vaccines work, or some of the side effects could potentially cause flu-like symptoms or the flu itself. For that individual, it's a little bit skeptical. Say it's me. Sell me on why a vaccine is so important and that it's safe.
Well, I often tell people, we live in Nevada, we're a bedding state. So I think, some protection is obviously better than none. I also always remind people that your flu shot just doesn't protect you. It protects your loved ones, and it contributes to the protection of our community. And so that kind of goodwill piece of it, I think right now we're all in this together. And it's really important for everybody to do their part. And so that's, I think, a very key piece. And, the bottom line is you can't get the flu from the flu shot. There's a bazillion articles and resources out there, to help everybody understand that. But, just doing your part this flu season is key to keep Nevada healthy.
And maybe direct us to some resources. You're right, there are a bazillion articles out there, and sometimes it's hard to kind of disseminate all that information. Mm-hmm. So local resources here, where can we get some really good information on the immunizations, and then also access to our vaccines?
Absolutely. So just Southern Nevada Health District, their website is really great for both their services and then also just what's happening in the community. ImmunizeNevada.org, we have a substantial section on flu, lots of FAQs. We have resources for businesses, childcare providers, and also healthcare professionals. And then also on our site, we do have a community calendar with those clinic sites listed for each day. Southern Nevada Health District has the same, for where they're going to be. And then we also have a general where to go page. So if someone is uninsured, they don't have a medical home, we have a substantial list of all of the places that they can access. I would also emphasize that many of those clinics do have appointments available now. As Brian mentioned, they have seen a decline in services, but they are open. And if you need a medical home and need to get established somewhere, there are multiple options.
Great advice, great resources. We're out of time, unfortunately, but Brian, Dr. Loff, Heidi, very much appreciate all of your expertise, all of your recommendations. Thank you so much. Thank you, as always, for joining us this week on Nevada Week. Now, for any of the resources we've discussed on this show, please visit our website at vegaspbs.org/Nevada-Week. You can also find us on social media at Nevada Week.